I would now like to turn the conference over to Governor Phil Murphy. Thank you. You may begin.
Chelsea, thank you. Chelsea's our operator today and our MC, so thank you for that. There'll be three speakers on the speaking program, but obviously we've got others with us should other questions arise. I'm honored to kick things off. We'll then go to Health Commissioner Judy Persicelli, and then to the Director of Homeland Security, Jared Naples. We've got Colonel Pat Callahan on with us, Lieutenant Governor Sheila Oliver, and others with us. And I want to thank each and every one, as well as the rest of our public health and safety teams who are available to answer your questions. After we do our brief remarks, we're going to take questions, but please, I know there are a lot of interested citizens out there. We have to limit the questions to media only. We will be back with you live tomorrow. That will be, unless you hear otherwise, at 12 noon at the War Memorial in Trenton. The reason that'll be earlier is because we have a BTC with the President and Vice President right after that. And again, remember, as we've said already, when it's earlier in the day, we may have less visibility into the overnight numbers, so please bear with us. I'll speak for myself, and I know Judy and Jared and Pat and the Lieutenant Governor, and I can't thank the Lieutenant Governor enough for her partnership. I know we're all sort of beating on similar drums here, but I've been spending my time since we last spoke checking in with a lot of the hospital CEOs to see how they're doing up and down the state, basically going through a rotation. Kevin Slavin in particular, representing the hospital associations as their chair, in addition to his leadership at St. Joe's. And, hearing the not surprising concerns, anxiety, asks that we're hearing out of the healthcare systems. Spending a lot of time talking, and I want to thank the leadership up and down the state. I want to thank as well fellow elected officials. We've had an enormous amount of back and forth, both within the New Jersey delegation as well as with other fellow governors around the country. I've just been told you got some static coming in from this line, so please bear with me, Chelsea. I'm going to come back into you on a separate line, so please bear with me. We'll be right back.
Governor Murphy has rejoined the conference.
Hey, folks, sorry about that. I'm not sure what happened, but we're back. Mahed, is that better? Yeah, better. Okay. Again, thank you, everybody, for joining. I won't repeat what I've already said, but just was in the middle of sort of giving folks a sense of how I'm spending my time. A lot of hospital CEOs had a good healthcare, a smaller group union discussion on Friday night, which I meant to say yesterday. Lots of time with elected officials, both in our delegation around the state, at the county and local level, as well as around the country, among other governors. Just had an exchange a short while ago with Governor Newsom of California, by example. The four big themes to me are continue to be PPE, and Judy will talk more about that, but that is a constant topic of concern and question, and we are doing everything we can. Colonel Callahan, along with Judy and their teams, including, by the way, big shout-outs to the private sector who are stepping up. I mentioned some players already earlier in the week. I want to add Prudential to that list, who have really stood tall, among others who are just coming out of this moment of crisis as extraordinary citizens. Healthcare systems themselves, Kevin Slavin committed on behalf of all the healthcare systems that they were all in on helping us develop at the Rock a statewide inventory, get a real sense of timelines. We're continuing to ask the federal government for support. I did that on national television this morning. We'll do it again, obviously, constantly with our elected officials with the White House. Second big theme is testing. You'll hear more about that from myself and Judy in a minute. Thirdly is beds, and that's a lot of the work we're doing at the Army Corps of Engineers. Obviously, remember, folks, our two big initiatives are one, flatten the curve, so we can take pressure off the healthcare system and smooth this in a much more manageable way. But at the same time, not taking any chances, making sure we've got the capacity that we need in the healthcare system. And then the other big theme is federal money. Again, I mentioned this on national television earlier. Just this region alone, New Jersey, New York, Pennsylvania, Connecticut, we think collectively we need $100 billion of direct cash assistance from the federal government. There's deliberation going on in Congress right now. The number needs to be really meaningful if we're going to continue to be able to be there for our workers, small businesses, healthcare workers, folks who are infected with this virus. We're at the point of attack. We need the back and fill from the federal government to help us fund the massive amount of programs, which are not surprisingly leading to a bleeding of cash and an impact on the economy for individuals, for companies, and for the state itself. So those are the big themes. We are reporting today 590 new positive test results. Our statewide total is now 1,914. I repeat, this is what we expected. This is not a surprise. We knew, especially as we opened up testing, that we would have bigger numbers. And as we collect more specimens and then process those tests, that's exactly what we're seeing. Some of this is community spread without question, but the big up here is as a result of the testing. And again, folks, I want to make sure everybody understands. We understand the anxiety. We appreciate it. Who could not be anxious at this time? But the more data we have, the more we understand about the raw data, the better we will be able to crack the back of this virus sooner or later. And we will do that together as one New Jersey family. Sadly, we're reporting 4 additional deaths, bringing that total to 20 in New Jersey since the onset of this coronavirus. And our thoughts or prayers are with these blessed souls and their families. God rest their souls. Judy will have more color on both the 590 positive results as well as the 4 deaths. We do have our first, if I'm reading this right, we have our first case, sadly I might add, of a positive case in Salem County, which means coronavirus is now, as we had expected, in all 21 New Jersey counties. I want to reiterate my thanks to every New Jerseyan who is doing her or his part in helping us flatten that curve. Let me repeat what we said in stark terms yesterday. All residents are to stay inside if you do not need to be out. Until further notice, all non-essential retail businesses are to remain closed, and all employees who can work from home must work from home. Residents who are unsure of what businesses are closed by yesterday's order, and that was effective 9 p.m. last evening, or who need phone numbers or have questions about coronavirus, should all visit our new information and resource portal at covid19.nj.gov. That's covid19.nj.gov. And again, we hope that will be over time the most robust, all-encompassing information source for residents up and down the state. Tomorrow, the drive-through testing site at PNC Bank Arts Center in my home county of Monmouth off of Parkway Exit 116 will open at 8 a.m. It will be open daily from 8 a.m. until it reaches capacity. As we have experienced in Bergen County, which was again open for business today, we will have a similar experience in Monmouth County at the PNC, which is we have been allocated, and I want to thank our FEMA Region 2 partners for working with the State Police, Department of Health, National Guard, local county officials to help us get each of these sites up and standing, which has been a terrific feat over the past week. The challenge is, however, we have a limited amount of supplies, both the actual specimen testing supplies as well as PPE, so that these testing sites will be limited in the numbers they could deal with every day. But let me just say this, compared to Friday morning at 8 o'clock, we are now well over 1,000 folks more who were tested at literally just one site, and that number will begin to grow with the second drive-in site being added tomorrow. Let me remind everybody, to be tested, you need two things. One is you need to be a Jersey resident and have proof of that. And secondly, you've got to have symptoms of a respiratory illness. Do not go to either the Bergen Community College site or the PNC Bank Art Center if you're not a Jersey resident and you're not symptomatic. We cannot right now, with limited supplies and limited manpower, accept what is being referred to as the worried well. We appreciate the worry. We understand it. But if you don't have symptoms, we don't have enough manpower or raw material to test you. One more health warning on PNC. Please don't go to the PNC Bank Art Center prior to tomorrow morning. And again, do not go if you're not exhibiting symptoms. And we're all well aware of the national shortage of supplies, and we're doing everything we can about that. We've been ahead of the curve at our testing posture at every step of the way, probably compared to any other American state, which is good news. But we still need to ensure that we're using these supplies in the most prudent way, because no matter how far ahead of this we might get, we are limited by the supplies that we are getting to use for these testings. We know there's pent-up demand for testing. That's an obvious point. The state police, local authorities, National Guard, again, I can't say enough good things about them, as well as our extraordinary heroes, healthcare workers, will be on site in the first instance to direct traffic and ensure public safety. Once the facilities at capacity, new arrivals will be asked to return the next day. And we ask everyone, please have patience and follow the directions of public safety and public health officials. Not related to FEMA Region 2, but importantly, Union County is also opening a testing facility at Keene University for its residents, first responders, and county workers tomorrow. That facility is open by appointment only, and Union County residents must work through their primary care provider. So we tip our hat again to our brothers and sisters in Union County who are working to get that up and running. I have directed multiple state departments to ensure that our residents have access to the telehealth services they need whenever possible. Today we will be announcing critical telehealth and telemental health options for more than 3 million residents. These services will be accessible without copays. These services will ensure residents can have flexible access across a variety of platforms to vital care from the comfort and safety of their homes. One final note before I turn things over to Judy, which I'm not happy to even have to talk about, but we are hearing from, in particular, our Asian American communities, their concerns regarding incidents of racism. To be clear, this repugnant and repulsive behavior is wrong even in good times, but it is even more repugnant and more repulsive now. Our diversity is one of, if not the core strength of our state, and that strength will get us through this. We are one New Jersey family. Everyone is fighting the same fight. Everyone is making the same sacrifices. We are going to get through this together. Stay in, everybody. Please stay home unless you absolutely need to go out. Stay safe. Stay smart. And let's stay compassionate to one another. It's our New Jersey values that will get us through this emergency and make us even stronger when, and I say when, we emerge from it. I mentioned this on national television earlier today. We didn't win World War II because we panicked. We didn't win World War II because we started to divide on each other and turn on ourselves. Wars, and this is a war. We win wars when we stay calm, when we're fact-based, when we realize we're one family, when we're proactive, when we're aggressive, when we're transparent, when we're straight with each other, and that we recognize we go up and down, we rise and fall as one extraordinary, diverse New Jersey family. With that, I turn it over to, again, the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli.
Thank you, Governor, and good afternoon, everyone. As the Governor said, we sadly report 4 additional deaths. This makes the total number of deaths in New Jersey at 20. The age range for the 20 deaths is between 30 years and 98 years, for the median age of 73. The 4 new deaths that we're reporting today include a male in his 90s from Bergen County, a male in his 80s from Passaic, a female in her 90s from Middlesex, and a male in his 70s from Somerset County. We do know that the deaths in Bergen and Passaic involve individuals with underlying medical conditions. We are still investigating the other 2 individuals. The families of every one of these individuals is in our thoughts at this very difficult time. We're also announcing 590 new cases for a total of 1,914 cases in the state. The county breakdown is as follows: Atlantic 1, Bergen 94, Burlington 5, Camden 7, Essex 65, Gloucester 2, Hudson 29, Hunterdon 2, Mercer 10, Middlesex 31, Monmouth 66, Morris 55, Ocean 39, Passaic 29, Salem 1, Somerset 17, Sussex 6, Union 42, Warren 4, and there are 85 cases that we are still gathering information on. As I've said, we expect these numbers to increase. That's why we're doing everything in our power to prepare to flatten the curve by closing non-essential businesses and practicing aggressive social distancing. We are aggressively planning to open closed hospitals, stand up field hospitals, and open up unused wings of existing hospitals. We are doing this with the assistance of the U.S. Army Corps of Engineers. As more counties prepare to open community-based drive-through coronavirus testing sites, I want to emphasize that if you have symptoms, including fever, shortness of breath, or cough, you should call your primary care provider and be assessed. Those with underlying medical conditions and those who are 65 and older who have symptoms are particularly at risk and should be more vigilant. As we've been saying, we absolutely appreciate and understand that the rising number of cases, along with the curtailment of our daily activities and normal routines, is causing people to be anxious and concerned. If you are concerned about your well-being or your mental health or the mental health of someone you love, the free mental health care hotline can help. It offers free telephone counseling, emotional support, information, and assistance. It is available 7 days a week between 8 a.m. and 8 p.m. and the number is 866-202-HELP, H-E-L-P, 866-202-HELP, H-E-L-P. I'd also like to say a few words about the critical blood shortage we are experiencing in our state and the need for healthy people to donate to help ensure our hospitals have an adequate blood supply. The need for blood is constant in our healthcare facilities, and the need right now is becoming increasingly urgent. Coronavirus is a new virus. Novel coronavirus is a new virus. But there is no evidence that the virus can be transmitted by donating blood. Our blood centers are taking every precaution to protect donors at this critical time, including the use of proper protective equipment, increased sanitizing and disinfecting, and adherence to social distancing. Our healthcare workers are doing an amazing job taking care of us in this unprecedented public health emergency. The last thing we want to do is add to the crisis because of a depleted blood supply. I know so many of us feel helpless in the face of this particular crisis. So there is something you can do to help those in need. I urge you to contact Bergen Regional Community Blood Center, New Jersey Blood Services, or the American Red Cross and make an appointment to give. There are locations throughout the state with flexible hours to accommodate our communities. It's one concrete way we can all roll up our sleeves and help. So if you're in good health and you're feeling well, if you don't feel well on the day of your scheduled appointment, please cancel your donation. But if you're in good health and feeling well, please donate blood to help our community. I want to address the issue of personal protective equipment, the resources and demand both now and in the days ahead. Under the auspices of the New Jersey State Police, we are centralizing an effort to manage the inventory of supplies led by the Office of Emergency Management. OEM will coordinate with the New Jersey Hospital Association to maintain an ongoing count of statewide supplies in order to address the needs of individual hospitals, long-term care facilities, first responders, and others throughout New Jersey. I want to thank the individual healthcare systems for sharing their inventories as needed, as well as your maximum cooperation going forward. I also want to thank the New Jersey Hospital Association for coordinating and centralizing communications within the hospital community, which allows our team here at the Department of Health to be more efficient in getting services where they are needed as fast as possible. Please rest assured, as the governor has said, we are doing everything in our power, working around the clock to respond to the cases of COVID-19, to increase testing sites, expand hospital bed capacity, and get protective equipment for our valued and life-saving healthcare providers. In closing, to clarify my comments, all of us are at risk of getting COVID-19 if we do not practice aggressive social distancing, respiratory etiquette, hand washing frequently throughout the day, and covering our coughs and sneezes. Thank you.
Judy, thank you for that. Two quick comments before I ask Jared Maples to say a few words, and then we'll open it to questions. Number one, just to repeat something Judy said and I referred to, where would we be without our healthcare workers? Where would we be without our first responders? I had a call on Friday with law enforcement and first responders, including both police and fire, state, county, and local, with the chiefs up and down the state, and made this point. Healthcare workers, just extraordinary heroism day in and day out. And so that's the first. I'm actually going to make three quick points. Number one. Number two, Judy's last point. Let's just let there be no doubt about this. We're all going to die trying to keep the number as low as we physically and humanly can. It's why both low in terms of folks who get it and certainly folks who get really sick from it and or, God forbid, pass as a result from this virus. We're going to die trying. I will tell you, we will not leave anything on the practice field. We'll turn over every stone to keep this number as low as we humanly can. But we also owe it to you to be straight with you in terms of what the reality is as we go through that process, and we promise that as well. But no matter how many cases we have, remember, flattening the curve not only impacts how many cases, but it impacts the pace of cases and therefore the stress on our healthcare system. So you could have the same amount of cases in a we don't care world, let the virus run wild with a huge spike in the curve, which would bring our healthcare system to its knees, or with the same amount of cases, you could flatten that curve, break the back of it, smooth it over a longer period of time, perhaps. Not that we want this around any longer than we have to, but allow the healthcare system and its capacity, in particular the capacity that Judy is adding, it will allow us to withstand a comparable amount of cases. So both statements are true. Number one, we're doing everything we can to keep the number of cases, and particularly serious illness and fatalities, as low as humanly possible. But we will be straight with you as we do that. That's why we're telling you stay inside. But by the same token, if we had the same amount of cases, the flattening of that curve is a huge deal in and of itself. It allows our healthcare system to digest a similar amount of cases, but in a more smooth, more coherent fashion. My last point, which I don't think I hit hard enough in my remarks, and Judy, this is not related necessarily to yours specifically, but when we say stay inside, Pat Callahan is on, and I'll be very happy when we take questions for Pat to weigh in here. We mean it, and we're not happy when we see folks flaunting that, and we will take action. The only way we're going to flatten this curve is everybody stay inside, work from home, only go out if you have to, only go out if you are helping us fight this virus, period. No exceptions. With that, we'd love to turn it over, particularly as I mentioned yesterday in our live gathering in Newark, there's a lot of false information out there, and we can't implore you enough to rely only on official sources. And to make that point starker and put more flesh on that, please help me welcome the Director of the Department of Homeland Security, Jared Maples.
Thank you, Governor. We know that there is an ongoing disinformation campaign, both regarding the origins of COVID-19 and an impending national lockdown, among several other areas. That information is false. The federal government, through the U.S. Department of Homeland Security National Operations Center and the National Security Council, along with my office here in New Jersey, have publicly reiterated that this information is false. To really emphasize the Governor and Judy, the Commissioner Persikilli's points, it is so vital in this situation with this virus to make sure the information is correct, and you're getting that information only from trusted, established sources, such as the COVID-19.nj.gov portal that was just launched yesterday, along with our various other official channels and reputable news sources. It becomes important and, quite frankly, vital to getting through this as a stronger New Jersey together, just like the Governor mentioned. With that, I'll turn it back over to the Governor.
Jared, thank you, and thanks for all your help here.